ನಮಸ್ಕಾರ, ನೀವು ನೋಡ್ತಾ ಇದ್ದೀರಾ ವೇಗ ಎಕ್ಸ್‌ಪ್ರೆಸ್ ನ್ಯೂಸ್. ಇವತ್ತು ನಾವು ನಿಮಗೆ ವೈದ್ಯಕೀಯ ಲೋಕದ ಮಹತ್ತರ ಸಾಧನೆಯೊಂದರ ಕಥೆಯನ್ನು ಹೇಳಲಿದ್ದೇವೆ. ಇದು ಕೇವಲ ಮೆಡಿಕಲ್ ಸೈನ್ಸ್ನ ತಾಕತ್ತನ್ನು ಮಾತ್ರವಲ್ಲ, ಮಾನವೀಯತೆಯ ಹೊಸ ಮೈಲಿಗಲ್ಲನ್ನು ಜಗತ್ತಿಗೆ ಸಾಬೀತುಪಡಿಸಿದೆ. ಬೆಂಗಳೂರಿನ HCG ಕ್ಯಾನ್ಸರ್ ಸೆಂಟರ್ನ ವೈದ್ಯರು ಅಸಾಧ್ಯವೆನಿಸುತ್ತಿದ್ದ ಅತ್ಯಂತ ಅಪರೂಪದ ಶಸ್ತ್ರಚಿಕಿತ್ಸೆಯನ್ನು ಯಶಸ್ವಿಯಾಗಿ ಮುಗಿಸುವ ಮೂಲಕ ಕೇವಲ 28 ದಿನದ ನವಜಾತ ಹೆಣ್ಣು ಮಗುವಿಗೆ ಮರುಜನ್ಮ ನೀಡಿದ್ದಾರೆ. ಈ ಪುಟ್ಟ ಕಂದಮ್ಮ ಹುಟ್ಟಿದಾಗ ಬಲಗೈನಲ್ಲಿ ಸಣ್ಣದೊಂದು ಗಡ್ಡೆ ಇತ್ತು. ಆದರೆ ಕೆಲವೇ ದಿನಗಳಲ್ಲಿ ಅದು ಬರೋಬ್ಬರಿ 11.3 × 9.8 ಸೆಂಟಿಮೀಟರ್ನಷ್ಟು ಬೃಹತ್ತಾಗಿ ಬೆಳೆದಿತ್ತು. ವೈದ್ಯಕೀಯ ಭಾಷೆಯಲ್ಲಿ ಇದನ್ನು ಇನ್ಫ್ಯಾಂಟೈಲ್ ಫೈಬ್ರೋಸಾರ್ಕೋಮಾ ಎಂದು ಕರೆಯಲಾಗುತ್ತದೆ. ಇದು ನವಜಾತ ಶಿಶುಗಳಲ್ಲಿ ಕಂಡುಬರುವ ಅತ್ಯಂತ ಅಪರೂಪದ ಮೃದು ಅಂಗಾಂಶದ ಕ್ಯಾನ್ಸರ್ ಆಗಿದೆ. ಸ್ಕ್ರೀನ್ ಮೇಲೆ ಮಗುವಿನ ಕೈನಲ್ಲಿದ್ದ ಗಡ್ಡೆ ಮತ್ತು ಆಸ್ಪತ್ರೆಯ ದೃಶ್ಯಗಳು ಪ್ಲೇ ಆಗುತ್ತವೆ. ಬ್ಯಾಕ್ಗ್ರೌಂಡ್ನಲ್ಲಿ ಆಂಕರ್ ಧ್ವನಿ ಮುಂದುವರಿಯುತ್ತದೆ. ಹಲವಾರು ಪ್ರಮುಖ ಆಸ್ಪತ್ರೆಗಳು ಮಗುವಿನ ಜೀವ ಉಳಿಸಲು ಕೈಯನ್ನು ಕತ್ತರಿಸಿ ತೆಗೆಯುವುದೊಂದೇ ಆಂಪ್ಯುಟೇಷನ್ ದಾರಿ ಎಂದು ಹೇಳಿದ್ದವು. ಇದರಿಂದ ಪೋಷಕರು ಸಂಪೂರ್ಣವಾಗಿ ಕಂಗಾಲಾಗಿದ್ದರು. ಆದರೆ HCG ಕ್ಯಾನ್ಸರ್ ಸೆಂಟರ್ನ ಆರ್ಥೋಪೆಡಿಕ್ ಆಂಕಾಲಜಿ ವಿಭಾಗದ ಮುಖ್ಯಸ್ಥರಾದ ಡಾಕ್ಟರ್ ಪ್ರಮೋದ್ ಎಸ್ ಚಿಂದರ್ ನೇತೃತ್ವದ 14 ರಿಂದ 16 ಸೂಪರ್ ಸ್ಪೆಷಲಿಸ್ಟ್ ವೈದ್ಯರ ತಂಡ ಈ ಸವಾಲನ್ನು ಸ್ವೀಕರಿಸಿತು. ಸವಾಲು ಮತ್ತು ತಂತ್ರಜ್ಞಾನ. ಮಗುವಿನ ವಯಸ್ಸು ಕೇವಲ 28 ದಿನವಾಗಿದ್ದರಿಂದ ರಕ್ತನಾಳಗಳು ಅತ್ಯಂತ ಸೂಕ್ಷ್ಮವಾಗಿ
I'm an orthopedic oncology. I head the department orthopedic oncology. Andre it's a bone cancers. Makkuludu, mainly makkulu. It's very rare specialty across the world. So I head it in HCG Bangalore. We started it 16 years back. So we have treated more than 7,000 to 8,000 patients so far in this specialty. In that, we have crossed. It is not just numbers. It's an important numbers alla. It is a quality of outcome. So we have passed the quality of outcome of Western standards. Andre Europe, America, ಆ ಥರದ್ದು ಸ್ಟ್ಯಾಂಡರ್ಡ್ಸ್ ಏನು ಪಬ್ಲಿಷ್ ಆಗಿರುತ್ತೆ ಅದನ್ನು ಕ್ರಾಸ್ ಮಾಡಿದ್ದೀವಿ. ಅಂದರೆ ಅವರ್ ಔಟ್ಕಮ್ಸ್ ಆರ್ ಆನ್ ಪಾರ್ ವಿತ್ ಏನು ಅಮೆರಿಕಾದಲ್ಲಿ ಅಥವಾ ಯುರೋಪಲ್ಲಿ ಸಿಗುತ್ತೆ ಅದಕ್ಕಿಂತ ಬೆಟರೇ ಇದೆ ನನ್ನ ಪ್ರಕಾರ. ಅಂಡ್ ವಿ ಪಬ್ಲಿಷ್ಡ್ ಇಟ್. ನಾ ಹೇಳ್ತಾ ಇರೋದಲ್ಲ, ಇಟ್ ಇಸ್ ಪಬ್ಲಿಷ್ಡ್ ಇನ್ ದ ಜರ್ನಲ್ಸ್. ಸೊ ದಟ್ ಇಸ್ mainly possible because of a huge team, agility and the ecosystem. For example, ನಮ್ಮ HCG ಅಲ್ಲಿ ಒಂದು ಆರ್ಥೋಪೆಡಿಕ್ ಆಂಕಾಲಜಿ ಡಿಪಾರ್ಟ್ಮೆಂಟ್ ಅಂದರೆ ನಾನು ಒಬ್ಬನಿಂದನೇ ಮಾಡೋಕ್ಕಾಗಲ್ಲ. ಇಟ್ ಇಸ್ ನಾಟ್ ಪಾಸಿಬಲ್ ಫಾರ್ ಮೀ ಟು ಡೂ ಅಲೋನ್. ಇಟ್ಸ್ ಅ ಹ್ಯೂಜ್ ಸಿಸ್ಟಮ್ ಆರ್ ಎಕೋಸಿಸ್ಟಮ್ ಬಿಲ್ಟ್. ಇಟ್ ಕುಡ್ ಬಿ ಡಾಕ್ಟರ್ಸ್ ಆಫ್ ವೇರಿಯಸ್ ಸ್ಪೆಷಾಲಿಟಿ ಲೈಕ್ ಪೀಡಿಯಾಟ್ರಿಕ್ ಆಂಕಾಲಜಿ, ರೇಡಿಯಾಲಜಿಸ್ಟ್, ಇಂಟರ್ವೆನ್ಷನ್ ರೇಡಿಯಾಲಜಿಸ್ಟ್, ಆ ಥರ ಎಲ್ಲರೂ ಸೇರಿಬಿಟ್ಟು ಒಂದು ಈ ಮಗುದು ನಾವೊಂದು ಕ್ಲಿಕ್ಕರ್ ಇದೆ. ಏನು ಮಾಡೋದು ಪ್ರೆಸೆಂಟೇಷನ್? ಹೌ ಡು ಐ ಪ್ರೆಸೆಂಟ್ ಇಟ್? ಓಕೆ, ಥ್ಯಾಂಕ್ಸ್. ಸೊ ಆ ರೀತಿ ಹೆಂಗ್ ಒಂದು ಮಗು ಈಗ ಒಂದು 28 ಡೇ ಓಲ್ಡ್ ಚೈಲ್ಡ್, ಇದು ನಾನು ಹೇಳೋದು, ನೀವು ಇದೊಂದು ಕೇಸ್ ಮಾಡಿದೀವಿ, ಸ್ಪೆಷಲ್ ಮಾಡಿದೀವಿ ಅನ್ನೋದಕ್ಕಿಂತ ಇದನ್ನ ಒಂದು 1000 ಜನ ಹೆಂಗ್ ಉಪಯೋಗ ಪಡ್ಕೋಬೇಕು ಅನ್ನೋದನ್ನ ಐ ವಾಂಟ್ ಯು ಟು ಅಂಡರ್ಸ್ಟ್ಯಾಂಡ್. ಆ ನ್ಯೂಸ್ ಆಗ್ಬೇಕಂದ್ರೆ ಇಟ್ ಈಸ್ ನಾಟ್ ದಟ್ ಸಮಥಿಂಗ್ ಗ್ರೇಟ್ ಹ್ಯಾವ್ ಡನ್, ಸಮಥಿಂಗ್ ಗ್ರೇಟ್ ಹ್ಯಾವ್ ಡನ್. ಇಟ್ ಇಸ್ ಅಫ್ಕೋರ್ಸ್ ಇಟ್ಸ್ ಬ್ಯೂಟಿಫುಲ್, ಫ್ಯಾಂಟಾಸ್ಟಿಕ್. ದೇರ್ ಇಸ್ ನೋ ಡೌಟ್. ನಾಟ್ ಇವನ್ ಐ ಡೋಂಟ್ ಸಿ ಎನಿಬಡಿ ಡನ್ ಇನ್ ದ ವರ್ಲ್ಡ್ that I can tell you in front of on the media only. This is one of its case in the world. We can write it, quote it, ask anybody, vet it by any possible journal. But more than that, how the same process of how we made this possible should be translated to other children across our country first. It can't be agalla bidu annೋದು very easy. ಬಿಡು ನನ್ನ ಹತ್ರ ಆಗಲ್ಲ, ದುಡ್ಡಿಲ್ಲ, ಕೆಪಾಸಿಟಿ ಇಲ್ಲ. ಇಟ್ಸ್ ವೆರಿ ಈಸಿ. ಬಟ್ ಹೌ ಡು ವಿ ಸೇ? ಬಟ್ ಆಗುತ್ತೆ ಅನ್ನೋದು ಒಂದೇ, ಆಗಲ್ಲ ಅನ್ನೋಕ್ಕೆ 1000 ರೀಸನ್ಸ್. ಹೌದಾ? MRI ಮಾಡೋಕ್ಕಾಗಲಿಲ್ಲ ಸರ್, ಬಸ್ ಬರಲಿಲ್ಲ ಸರ್, ಮೆಟ್ರೋ ಬರಲಿಲ್ಲ ಸರ್, ದುಡ್ಡಿರಲಿಲ್ಲ ಸರ್. ಬಟ್ ಮಾಡಕ್ಕೆ ಒಂದೇ, ವಿ ಹ್ಯಾವ್ ಟು ಡೂ ಇಟ್. ಸೊ ದಟ್ ಈಸ್ ಅನ್ ಎಕ್ಸಾಂಪಲ್ ವಿತ್ ದಿಸ್ ಕೇಸ್. ಐ ಜಸ್ಟ್ ವಾಂಟ್ ಟು ಕ್ವಿಕ್ಲಿ ರನ್ ಥ್ರೂ. ಕೆಲವು ಬ್ಲಡ್ ಎಲ್ಲ ಇದೆ, ಓಕೆ, ಅಲ್ಲಿಂದ I'm a orthopedic oncology. I head the department orthopedic oncology. Andre it's a bone cancers. Makkaludu, mainly makkalu. It's very rare specialty across the world. So I head it in HCG Bangalore. We started it 16 years back. So we have treated more than 7 to 8,000 patients so far in this specialty. In that, we have crossed, it is not just numbers, it's an important numbers, Allah. It is a quality of outcome. So we have passed the quality of outcome of Western standards. Andre Europe, America, ಆ ಥರದ್ದು ಸ್ಟ್ಯಾಂಡರ್ಡ್ಸ್ ಏನು ಪಬ್ಲಿಷ್ ಆಗಿರುತ್ತೆ ಅದನ್ನು ಕ್ರಾಸ್ ಮಾಡಿದ್ದೀವಿ. ಅಂದರೆ ಅವರ್ ಔಟ್ಕಮ್ಸ್ ಅವರ್ ಆನ್ ಪಾರ್ ವಿತ್ ಏನು ಅಮೆರಿಕಾದಲ್ಲಿ ಅಥವಾ ಯುರೋಪಲ್ಲಿ ಸಿಗುತ್ತೆ ಅದಕ್ಕಿಂತ ಬೆಟರೇ ಇದೆ ನನ್ನ ಪ್ರಕಾರ. ಅಂಡ್ ವಿ ಪಬ್ಲಿಷ್ಡ್ ಇಟ್. ನಾ ಹೇಳ್ತಾ ಇರೋದಲ್ಲ, ಇಟ್ ಇಸ್ ಪಬ್ಲಿಷ್ಡ್ ಇನ್ ದ ಜರ್ನಲ್ಸ್. So that is mainly possible because of a huge team, agility, and the ecosystem. For example, ನಮ್ಮ HCG ಅಲ್ಲಿ ಒಂದು ಆರ್ಥೋಪೆಡಿಕ್ ಆಂಕಾಲಜಿ ಡಿಪಾರ್ಟ್ಮೆಂಟ್ ಅಂದರೆ ನಾನು ಒಬ್ಬನಿಂದನೇ ಮಾಡೋಕ್ಕಾಗಲ್ಲ. ಇಟ್ ಇಸ್ ನಾಟ್ ಪಾಸಿಬಲ್ ಫಾರ್ ಮೀ ಟು ಡೂ ಅಲೋನ್. ಇಟ್ಸ್ ಅ ಹ್ಯೂಜ್ ಸಿಸ್ಟಮ್ ಆರ್ ಎಕೋಸಿಸ್ಟಮ್ ಬಿಲ್ಟ್. It could be doctors of various specialty, like pediatric oncology, radiologist, intervention radiologist. ಆ ಥರ ಎಲ್ಲರೂ ಸೇರಿಬಿಟ್ಟು ಒಂದು ಈ ಮಗುದು ನಾವೊಂದು ಕ್ಲಿಕ್ಕರ್ ಇದೆ ಏನು ಮಾಡೋದು ಪ್ರೆಸೆಂಟೇಷನ್. How do I present it? Oh yeah, thanks. So ಆ ರೀತಿ ಹೆಂಗ್ ಒಂದು ಮಗು ಈಗ ಒಂದು 28 day ಓಲ್ಡ್ ಚೈಲ್ಡ್, ಇದು ನಾನು ಹೇಳೋದು ನೀವು ಇದೊಂದು ಕೇಸ್ ಮಾಡಿದೀವಿ, ಸ್ಪೆಷಲ್ ಮಾಡಿದೀವಿ ಅನ್ನೋದಕ್ಕಿಂತ ಇದನ್ನ ಒಂದು 1000 ಜನ ಹೆಂಗ್ ಉಪಯೋಗ ಪಡ್ಕೋಬೇಕು ಅನ್ನೋದನ್ನ ಐ ವಾಂಟ್ ಯು ಟು ಅಂಡರ್ಸ್ಟ್ಯಾಂಡ್. ಆ ನ್ಯೂಸ್ ಆಗ್ಬೇಕಂದ್ರೆ it is not that something great I have done, something great we have done. It is, of course, it's beautiful, fantastic. There's no doubt. Not even I don't see anybody done in the world that I can tell you in front of on the media only. This is one of its case in the world. We can write it, quote it, ask anybody, vet it by any possible journal. But more than that, how the same process of how we made this possible should be translated to other children across our country first. It can't be ಆಗಲ್ಲ ಬಿಡು ಅನ್ನೋದು ಭಾರಿ ಈಸಿ. ಬಿಡು ನನ್ನ ಹತ್ರ ಆಗಲ್ಲ, ದುಡ್ಡಿಲ್ಲ, ನನ್ನ ಕೈಲಿ ಕೆಪಾಸಿಟಿ ಇಲ್ಲ. ಇಟ್ಸ್ ವೆರಿ ಈಸಿ. ಬಟ್ ಹೌ ಡು ವಿ ಸೇ ಬಟ್ ಆಗುತ್ತೆ ಅನ್ನೋದು ಒಂದೇ, ಆಗಲ್ಲ ಅನ್ನೋಕ್ಕೆ 1000 ರೀಸನ್ಸ್. ಹೌದಾ? MRI ಮಾಡೋಕ್ಕಾಗಲಿಲ್ಲ ಸರ್, ಬಸ್ ಬರಲಿಲ್ಲ ಸರ್, ಮೆಟ್ರೋ ಬರಲಿಲ್ಲ ಸರ್, ದುಡ್ಡಿರಲಿಲ್ಲ ಸರ್. ಬಟ್ ಮಾಡೋಕ್ಕೆ ಒಂದೇ, ವಿ ಹ್ಯಾವ್ ಟು ಡೂ ಇಟ್. ಸೊ ದಟ್ ಈಸ್ ಅನ್ ಎಕ್ಸಾಂಪಲ್ ವಿತ್ ದಿಸ್ ಕೇಸ್. ಐ ಜಸ್ಟ್ ವಾಂಟ್ ಟು ಕ್ವಿಕ್ಲಿ ರನ್ ಥ್ರೂ. ಕೆಲವು ಬ್ಲಡ್ ಎಲ್ಲ ಇದೆ.
And today, I don't want to address as COO of the company. I think as a person, as a parent, it has been my privilege to see how extraordinary clinical excellence, along with compassion, innovation, technology, and teamwork, how all of them come together to save a life. So just what Dr. Pramod said, this 28-day-old girl came to us. Parents were hassled because one of a kind, one of the rarest, tissue cancers, infantile fibrosarcoma, which is one of the rarest in the world. And they were turned away from many places. Wherever they went, people said amputation will be required. You may be prepared for mortality. But when they came to us, to our team in HCG, the team did not say, can we do this? Team said, how can we do this? Not just to save her life, but to give best quality of life after saving life. And that is the approach and that is the ethos of work at HCG. Of course, adding to what Dr. Pramod already said, what followed was a multidisciplinary team going through the case, examining the child and sitting together to make the entire treatment protocol very personalized for the child. So we have ortho-onco team led by Dr. Pramod, an interventional radiologist, pediatric oncologist, onco imaging specialist, geneticists, oncopathologists, rehab experts, nurse practitioners. Everyone sat together and made a tailor-made treatment protocol for the child. And that is very foundation of what HCG is built on. That we don't do cookie cutter ABC, which is what they were told in all other places, but we make a treatment protocol which is personalized for the patient, because cancer is heterogeneous. It manifests differently in different patients. Therefore, the treatment also deserves to be different for every patient. And that is what we did. And using 3D surgical technique, using very high-end super selective embolization, targeted therapy, genomics, microvascular reconstruction for the neonatal. So all these techniques were used, and this not just saved the life but preserved the function of life, the joy of life, which is what is required. And of course, the treatment ensued for some time, and when the financial constraints came in front of the family, another culture at HCG is not to say no to treatment to any patient. The patient has come to us. It is our responsibility. We figure out and give the best treatment to the patient. We don't want it to be hampered or stopped because of financial obstacles, and which is what happened here, as Dr. Pramod showed in the picture. Starting from our own doctors, our caregivers, our staff members, of course, management being involved, but externally, our foundation, philanthropists, friends, well-wishers, school children, you saw in the picture, how everybody beautifully pitched in to support the family, not just for treatment sake or to get credit or to get certified, but because this is the basics of being human. And I think this example of humanity, this is as exemplary as the surgery itself. It is equivalent to the treatment that was given to the patient. Today at HCG we have 24 hospitals across India. We have 7 in Karnataka, we have 3 in Bangalore itself. Given our footprint and our wide presence across the country, we have data stating every 8th cancer patient in the country gets treated in one of the HCG hospitals. But whether we treat one patient or 1,000 or 1 million or 10 million, our way of treating the patient is the same, which is high-end, personalized, multidisciplinary care, tailor-made to the cancer that is for that particular patient. So it's very precise, very personalized. For all the patients that are coming to HCG to ensure best clinical outcome as well as best quality of life after they recover. So keeping everything in mind, and we look forward to catering to more and more patients from here and outside. Thank you.
For the whole procedure, and how long it took for you to do the entire process?
No, that's a very deep question actually. Means how did I choose that confidence? How did we feel? I think it's the confidence, not the confidence, it's the ecosystem which we built over the 15 years. It made Marble, we can do something. That it can't come on one day. It is like we have solved many of these things, not like this exactly. One on the corner problem, we would have solved it. So we said, okay, let's know the background. I think, okay, I can talk to Manisha. I can ask something. I can ask somebody else. I can do something. So I'll ask my family or somebody to help in pitching. So all these things will connect your brain and okay, let's do something. And parallelly, this confidence will come. It cannot come like, okay, I can super surgeon. No, it is you need the support of the whole thing. I think that is, I somehow I feel I have people in every aspect of society who can pitch in. If I ask something, that is my. Number two, when you ask the duration of surgery, it is almost a week, 1 full week, in multiple stages, because a child can take 6, 7 hours, 8 hours anesthesia, which can go on. So that is also super important. I have to speak to the anesthetist. So we took to the Dr. Sunil is there. He planned it. So that is also very planned. It's like bande anesthesia kote no. Even he has to know the story of 1 week, because the drug which goes inside has to go out of the body for the child. Yeah.
Also,
Add to Dr. Pramod's answer, and he's been here now 15 years, 16 years. He has done innumerable number of very unique cases. And the reason why consultants like him and senior doctors are choosing to do this in HCG is because there is a multidisciplinary team that is involved right from the start. It's not like when the surgeon reaches a crisis point, they take intervention on the spot. So from the start itself, what Dr. Pramod described is they involved all the clinicians, pediatric oncologists, intensivists, anesthetists, interventional radiologists. So they were all involved from the start, knew about the case, had context. So come what may, push comes to shove, everyone is aware, alert and synchronized. So it is seamless teamwork, which is what gives a lot of confidence.
okay. Also, coming back to your own, you said that you will help the patient to raise fund from the crowdfunding and all that. Looking back at 300 to 400 individuals, contributing almost 3.5 lakhs. What is your suggestion or the message to the other families facing, devastating diagnosis but lacking the immediate means to afford it? Yeah.
No. So I think one is most important in our line of work is intent. If we intend to do it, we will find the means of doing it. So when you reach a place and you meet with doctors, you go to ecosystem that is well intending to help, patients will find help. Unfortunately, it may not be the case everywhere, but I think that is number one. Second, today there are many means available as financial respite for patients. There are a lot of organized players who help in fundraising. There are some you see on social media. There are a lot that work in the background. And large evolved organizations like us, we are in touch, we have tie-ups. We have our own HCG foundation that also, assisted financially in treatment of this patient. And besides that, I think, and what I mentioned is, it is very important to be human end of the day. We are all professionals. Second, first, we are humans. And to wear that lens is important. And how humanity has helped this child is as exemplary as how surgery has helped also, equally well done. So that way, there are many avenues of financial assistance available for patients that pay out of pocket.
I have two more questions. I'll end up. It's a layman question, doctor. Your patient, Thai, while she was pregnant, she must have obviously gone for multiple scannings and all that. Ali, possibility ಇರಲ್ಲ ಅವ್ರಿಗೆ ಸ್ಕ್ಯಾನ್ ಮಾಡಿದಾಗ they did not get to know what is the child's status. As the scanning we get to know. So was she informed about it and why it was not diagnosed? And,
Good question, actually, very smart. Because yes, this was missed in the scanning. Because sometimes in the whole scanning episodes, this is it should not be missed. Because that's why you see the super specialty scans now, feto-maternal medicine scans and bandide. Only to pick such things. Though it's very rare, as you rightly said, it was missed. Yeah, so that is one thing. Yeah.
So how did these digital innovations change your surgical roadmap compared to traditional planning? And do you see this becoming the standard of care for complex neonatal tumors?
Yeah, that's because see the problem right now is technology is there. We have to adopt. For example, we upgrade our iPhones. One ತಕ್ಷಣನೇ ಲೈನಲ್ಲಿ ನಿಂತ್ಬಿಟ್ಟು we'll buy it out. But when you say somebody has needed 3D printing, even the insurance companies don't approve first. You have to fight them out. Forget government. So, robot, don't approve. Cyberknife, you have to fight it out. But absolutely essential. If you are in 2026, you are using a smartphone, you're using everything, you're using a car, you're using an electric vehicle. You need this one also. It is not just why you need it. So it's very, very important. So that is when we started our own engineering company, which because it's very important to solve these problems. It's very difficult for someone else to come and solve your problems. And likewise the foundation, like what she said. So we want some funds at our disposal. If you have certain things in your pocket, you can give, alva. If you don't have anything, how can you give? So it is like in our ಚಾಣಕ್ಯ ಹೇಳ್ತಾರಲ್ಲ, ಸೊ ಇಟ್ ಇಸ್ ಲೈಕ್ ಅರ್ಥಸ್ಯ ಧರ್ಮಸ್ಯ ಮೂಲಂ ಅರ್ಥಂ ಅಂತ. ಅಂದರೆ ಇಫ್ ಯು ವಾಂಟ್ ಟು ಬಿ ರೈಟಿಯಸ್, ಇಫ್ ಯು ವಾಂಟ್ ಟು ಡೂ ರೈಟ್ ಥಿಂಗ್ಸ್, ಯು ನೀಡ್ ಟು have money. So that is very important. So for that, you need, all of us have to have that savings and some backup, some methodology. And if you are a social person, a community person, I think it's very easy. And I have one more rule for this. Actually, it's a very important rule. Now, all the patients who come, any patients, I always tell you should talk this physically to 5 friends and 5 relatives. It's very important. Sir, illa sir, ನಾವು ಮಾತಾಡೋದು ಬಿಟ್ಬಿಟ್ಟಿದ್ದೀವಿ ಅಂತ. There's one child which came. ನಾವು ಯಾರ ಹತ್ರ ಮಾತಾಡ್ತಾ ಇಲ್ಲ ನಮ್ಮ ಫ್ಯಾಮಿಲಿಯಲ್ಲಿ. ಯಾಕೆ? ನಾವೇನೋ ಜಗಳ ಆಡಿದ್ವಿ, ಅದು ಲ್ಯಾಂಡ್ ಇಶ್ಯೂ ಆಗಿ. ಇಲ್ಲ, ನಾನು ನಿಮ್ಮನ್ನು ಟ್ರೀಟ್ಮೆಂಟ್ ಮಾಡಬೇಕು ಅಂದ್ರೆ all 5 brothers should come. You don't believe, 1 week later, all 5 brothers from Dubai, from Bombay, this is a Bangalore patient, they were all everywhere. They came, and that was a unifier. They all 5 family people supported that child. So they have never spoken to the family in 15 years. So this is what is needed. Physical connect, social connect, people connect. I think everything can be solved.